As a nurse who owns a CCM RPM business, I have learned there are several reasons why medical providers may not implement chronic care management, CCM, and remote patient monitoring RPM services within their medical practice, despite serving patients who could greatly benefit from these valuable services. Here are some of the most common reasons that providers do not implement CCM within their practice. There is a lack of awareness on the availability of CCM and RPM programs. Many medical providers may not be fully aware of the CCM and RPM programs offered by CMS and the potential benefits they can bring to their practice and patients. Limited knowledge about the programs may cause them not to implement them. A nurse-owned CCM company can actively engage with medical providers through educational campaigns, providing informative materials, and targeted outreach programs to medical practices. They can offer presentations, webinars, and one-on-one consultations to increase awareness about the benefits, potential impact, and the bottom line. By providing comprehensive information, nurses can help providers understand the value of these programs and encourage their implementation within their practice. Another reason is resources. Implementing CCM and RPM in-house or inside of the medical practice requires dedicated resources, including staff and technology, to set up a successful program. Medical providers are already stretched thin with existing responsibilities, and they may find it challenging to allocate the necessary resources for implementing these additional services within their practice. By collaborating with a nurse-owned CCM company, a medical provider has access to a team of qualified clinicians who are experienced in care coordination and RPM services as well. They can offer flexible staffing solutions, allow medical providers to access skilled professionals without the need for additional hiring or training. So by utilizing the services of a nurse-owned CCM company, providers can leverage the expertise and resources that they have available, reducing resource constraints and ensuring the smooth implementation of CCM and RPM services. Understanding the reimbursement process for CCM. This involves specific documentation requirements and compliance with CMS guidelines. Some medical providers may perceive the reimbursement process as complex and time-consuming, which can deter them from incorporating these services into their practice. A nurse-owned care management company can assist medical providers in understanding the reimbursement requirements, ensuring proper documentation, and optimizing coding practices to maximize reimbursement for the services. By staying up to date with the latest CMS guidelines and regulations, these companies can guide providers through the complex reimbursement process, minimizing errors and ensuring their compliance with CMS guidelines for CCM and RPM. Resistance to change is often an issue. Medical practices often have established routines and workflows that may not easily accommodate the integration of CCM and RPM services. Resistance to change, both from the medical provider and the practice staff, can be a significant barrier to implementing new care management models within a medical practice. A nurse-owned CCM company can offer comprehensive change management to support the medical providers. They can provide training sessions and workshops to educate providers and their staff about the benefits and implementation strategies for CCM and RPM services. They can address concerns, clarify any misconceptions, and highlight success stories from similar implementations by offering ongoing support, open communication channels, and guidance throughout the change process. They can help providers overcome resistance and foster a positive culture for care management services to be implemented. Another reason that providers don't implement CCM, they have a demanding schedule. So with limited time for additional activities beyond direct patient care, the implementation of CCM and RPM services may require additional time commitments and coordination, which can be perceived as a challenge or a barrier to implementation. Working with a nurse-owned CCM company, the provider would be able to handle, the company would be able to handle time-consuming tasks that are associated with CCM and RPM services, allowing medical providers to focus on their core responsibilities of patient care. Nurse care managers can take care of care coordination, patient monitoring, documentation, and administrative tasks, providing comprehensive support, and this by freeing up the provider's time and reducing their administrative burden, they can ensure that CCM and RPM services are implemented efficiently and seamlessly. Another reason that providers don't implement CCM is a lack of dedicated staff. Effective implementation of CCM and RPM services typically involves a team-based approach with dedicated staff responsible for care coordination and monitoring. In many practices where CCM has been implemented, there is no dedicated staff to perform CCM, so the CCM program is not managed effectively. Some medical practices may lack the necessary staff or may not have the capacity to hire additional personnel to support these services. Working with a nurse-owned CCM company, the providers can receive support in handling administrative tasks that are associated with CCM and RPM services. That includes documentation, billing, and care coordination as well. Nurse care managers can provide efficient systems and processes, advanced software platforms, and experienced administrative staff who specialize in CCM and RPM services. They can ensure accurate and timely documentation, streamline billing processes, and coordinate care activities effectively. By taking care of the administrative aspects, they allow medical providers to focus on delivering quality patient care and reduce the burden of administrative tasks. Another reason doctors don't implement CCM within their practice, there may be concerns about patient engagement, because successful implementation of CCM and RPM services relies on active patient participation and engagement. Medical providers may have concerns about patients' willingness or their ability to engage with these services, especially if they serve a population with limited access to technology or populations with health literacy challenges. This is where a nurse-owned care management agency can help fill the gaps and engage patients. A nurse-owned CCM company can employ patient engagement strategies such as motivational interviewing and other methods to encourage active participation and adherence to CCM and RPM programs. One thing I know as a nurse I am skilled at is getting my patients to take their medication and also getting them to follow a plan of care by engaging them in conversations about their health and ensuring that they understand their medical condition. Nurses can leverage patient-friendly platforms like Facebook, personalized communication methods, and ongoing support to ensure patients feel empowered and motivated to engage in their own care. By providing educational resources, regular check-ins, and personalized care plans, they can address concerns about patient engagement and enhance patient outcomes. Regulatory and compliance concerns is another big issue. Medical providers may be hesitant to implement CCM and RPM services due to concerns about regulatory requirements and compliance with privacy regulations such as HIPAA, ensuring proper documentation, data security, and patient privacy can be perceived as potential challenges. A nurse-owned CCM company needs to ensure they have a business associate agreement, and this outlines with the provider. This helps to ensure that privacy practices are covered for both the provider and the nurse care manager. The nurse care manager will have a thorough understanding of the regulatory requirements and compliance standards, including HIPAA and other privacy regulations. They can provide comprehensive training and guidance to medical providers, ensuring that they are well informed and equipped to meet these requirements. By implementing secure documentation systems, data encryption protocols, and strict privacy measures, they can ensure compliance with regulations and alleviate concerns related to regulatory and compliance issue. Another issue providers are concerned with are financial considerations. While CCM and RPM services can bring long-term benefits, medical providers may have initial concerns about the financial viability of implementing these services in their practice. They may question the return on investment or have uncertainties about the potential revenue generated through reimbursement and providing these services. Nurse-owned care management agency can assist medical providers in determining the financial viability of implementing CCM and RPM services by analyzing potential revenue streams, reimbursement rates, and cost-saving strategies. They can help providers establish appropriate pricing structures and navigate the reimbursement processes, and identified opportunities for maximizing revenue. By providing guidance and customized financial models, they can help alleviate the provider's concerns and demonstrate the long-term financial benefits of implementing these services within a medical practice. And additionally, providers feel like they have limited support and guidance on these programs, and so they don't know how to effectively implement CCM and RPM services. The absence of clear implementation frameworks or mentorship programs can hinder their confidence and willingness to embark on a care management journey. By working with a nurse-owned CCM company, we can serve as a valuable resource to the provider and support the medical providers through the implementation process. We can offer mentorship programs as well as training sessions and ongoing consultations to address any concerns or any uncertainties the provider may have. The nurse care manager can provide implementation frameworks, best practice guidelines, and access to a network of other experienced professionals. By offering personalized support and sharing their own success stories and lessons they learned, they can empower medical providers with the knowledge and confidence necessary to effectively implement CCM and RPM services. It's important to address these concerns and provide comprehensive education, support, and resources to medical providers to encourage the implementation of CCM and RPM services. By addressing these barriers, we can enhance patient care, improve health outcomes, and create a more patient-centered healthcare system. By providers partnering with a nurse-owned CCM contractor or company, medical providers can leverage the nurse's expertise and their expertise and resources to navigate the regulatory requirements, address financial considerations, and receive the necessary support and guidance throughout the implementation journey. This partnership enhances the likelihood of successful implementation and enables providers to focus on delivering high quality care and care management services to their patients.